With temperatures in their 30s, the allure of the beach is hard to fight for some, even in a pandemic.
Yeah, we just think we're invincible. We want to be outside in the beautiful weather. We want to see our friends. We've been kind of cooped up for a little while, so maybe that's why we're not taking as much precaution as we should be anymore.
Even with the Black Lives Movement going on, people were able to leave their homes. They were able to break out of that isolation, and I think that also made a big difference.
People in their 20s are increasingly making up a bigger proportion of COVID-19 cases, especially in the Greater Toronto area.
We've certainly had some young people that have been admitted, some that have become very sick, but it is still in the minority compared to the vast majority of the patients that are requiring inpatient treatment.
In the first week of each of the past 4 months, those in their 20s have gone from 7.5% of total cases in March to 24% this month. In Hamilton, it's 43%. The increased availability of testing in Ontario could be one explanation for the higher numbers.
The other possibility is that young people are in fact getting this virus more now. And if that's true, it may be a function of the fact that young people are restricting less and maybe being less careful, and maybe they're congregating more. And we've seen some examples of that. And even, small pockets of congregation like that can lead to small outbreaks that might be driving these numbers.
The data available publicly doesn't point to where young people are getting infected, if it's socially or at work.
I think we need to know a little bit more about where these infections are being acquired and how they're being transmitted. So the key thing is, who are they bringing this home to? Are they living or exposed to elderly parents or elderly grandparents who might have a more severe outcome? So it's certainly concerning to see that.
Unless the spread of COVID-19 in young people is reduced, controlling a second wave of infections is unlikely. Vic Adopia, CBC News, Toronto.